Question number 9, Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. How many patients in the year to June 2013 who have been assessed as needing an operation but are unable to receive it within 5 months have been told they will not be receiving an operation at this time?
Honourable Tony Ryle.
Mr Speaker, as the member will know from her time, I'm unable to provide this information as it has never been collected nationally by the Ministry, and the vast majority of district health boards advised they do not collect this data or there were no patients. What I can advise the member is that the number of patients who have been told they will receive elective surgery and have received it has increased by 40,000 more patients this last year compared to 5 years ago. This increase in procedures means DHBs have been able to reduce the number of patients waiting at June 2013 from 7,000 in June 2005 under that member to over 200.
Point of order.
Mr Speaker, we all know what the question was, and the Minister said he couldn't answer it, didn't have the information, and then proceeded to answer some question that was never asked in the first place. He should have been stopped in his tracks.
I think on this occasion the member's got a fair point. The answer was certainly lengthy enough. I invite the Honourable Annette King to ask a supplementary.
Thank you, Mr Speaker. If, as he claimed last week, and again today, that the Ministry is not counting the number of people rejected from waiting lists because they can't get their operation within 6 months, and, as he said last week, quote, it's incredibly difficult to measure, how does he know that only 11 people are waiting longer than 6 months for their operation as of June 2013, which he has claimed for months now?
Mr Speaker, it's quite simple.
Honourable Tony Ryle.
Because while the member is trying to deliberately confuse the people of New Zealand, there are two separate figures. One is how many people were on the waiting list at a certain date. She keeps referring to people who didn't even get on the waiting list. Two separate figures.
Supplementary question, Mr Speaker.
Supplementary question, Honourable Annette King.
Well, in light of that answer, who should the public believe about the number of people being dumped off waiting lists? The specialists who deal daily with people who are in pain and who claim that his claims are nothing more than doublespeak, bearing no resemblance to reality, or to the CEO of Hawke's Bay District Health Board, Kevin Snee, who says that DHBs are dealing with, quote, a shortage of cash for orthopaedic operations and, quote, are struggling to meet demand, end quote, or him, who says, quote, I won't stand any criticism.
Honourable Tony Ryle.
Well, the one person they shouldn't believe is the person who was in a government that cut 30,000 people off hospital waiting lists and is a party that doctors OIA information.
That is a relatively political answer, but it doesn't actually address the question that was asked. If the member could have... I can have it repeated if the Minister likes.
Mr Speaker, they can certainly believe the answers that are provided by me and the Ministry of Health. More people are getting operations and they're getting them faster, and we are not culling 30,000 people off hospital waiting lists like that member opposite did when she was in government.
Supplementary question, Shane Arden.
Thank you, Mr Speaker. Supplementary question to the Minister. What reports has the Minister seen about waiting times for patients, in particular in the Mid-Central and Waikato?
Well, Mr
Honourable
Speaker,
Tony Ryle.
I saw a report last week from the opposition health spokesman where she stood in this parliament and claimed there were 376 patients waiting longer than 6 months at Waikato and 161 patients waiting at Mid-Central. Those numbers were a complete misrepresentation of the facts, as none of those people were on a waiting list despite what Mrs King claimed. And of course this follows up on a document sent to the Timaru Herald where the numbers had been inexplicably changed in handwriting, and Mrs King has yet to describe or explain why she did this.
Supplementary question, Mr Speaker. Supplementary question, Mr Speaker.
Order.
Just
Supplementary. Order. Order. Supplementary question, the Honourable Annette.
Are the views of clinicians still important to him, as he used to claim? If so, will he listen to Mr Bruce Hodson, an orthopaedic surgeon who recently wrote to a GP saying the waiting list system is being run in a clearly manipulated process and, quote, he can't see patients now because there are too many waiting to carry out their surgery within 5 months?
Honourable Tony Ryle.
Mr Speaker, I haven't seen that report at all, and based on that member's previous behaviour in this House, I'd have to actually check the context and the letter. But what I can say on the matter of orthopaedic surgery, more New Zealanders are getting orthopaedic surgery and they're getting it faster than ever before. A record 23,000 patients received orthopaedic surgery last year. Canterbury DHB does have capacity to do more, but unlike the previous government, we won't be cutting 1,000 orthopaedic patients from the Canterbury waiting list like that government did in 2006.
Supplementary question.
Supplementary question, the Honourable Annette King.
Has he read the editorial in the Southland Times today, which says there is no excuse for the government keeping, quote, truly crappy records of the level of unmet need in elective surgery, and that it's, quote, not morally defensible to trivialise the suffering of New Zealanders, quote, as he did last week? Or is this another case of him not standing criticism?
On order, Honourable Tony Ryle.
Mr Speaker, I have read that editorial from a small provincial newspaper, but I've also read the editorial in the Christchurch Press when referring to the government's performance on elective surgery.
I'm having trouble hearing the answer because of the noise. Could the Minister please continue?
Mr Speaker, I've also read the editorial in a very substantial provincial newspaper, the Christchurch Press, which, when referring to the massive increase in elective surgery under our government, it says, quote, those are impressive figures and it would be mean-spirited to downplay them, unquote. What a jolly good editorial that paragraph was.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
Mr Speaker, I seek leave to table a letter from Bruce Hodson, orthopaedic surgeon, to a GP, which says exactly what I said in this House
leave
a few moments ago.
That particular letter from the orthopaedic surgeon. Is there any objection to that course of action? It will be tabled. Honourable Annette King.
I seek leave to table 16 letters from 16 DHBs, all who send these letters out to patients saying their surgeon recommends them for surgery, but it cannot be offered to them at this time, making up the waiting list that's not recorded.
That's enough of a description. Leave us sent to table 16 letters from DHBs sent to patients. Is there any objection? There is none. They can be tabled. Question number 10, Jackie Dean.
Thank you, Mr Speaker. My question is to the Minister for the Environment and asks, what recent announcements